what can someone really expect after 3 months of TRT? How can I get my expectations real?
In anything in life, I always tell people the best way to meet your expectations is to lower them. I'm not trying to be a cynic here. You know, I always tell people, hope for the best, but expect the worst. It just keeps you grounded, because if you're always you can shoot for the stars, but if you expect the stars, you're always going to be disappointed, because perfection doesn't exist. And the strive to always do better than the norm is okay, but the expectation to meet that is always going to lead to disappointment. And chronic disappointment leads to depression, and it leads to frustration, and it leads to quitting. So set your expectations to something that is realistic, and then extend the time frame by which you think that you want to hit that goal by 20%. So if you want to hit something in a year, give it another 20%. Give it a year and a couple of months, because you've got to have that leeway. And guess what? You're going to be much happier if you meet your goals early, or you exceed your goals by your due date. So set expectations a little bit lower, but set the motivation and the strive to reach them as high as you possibly can. There's a difference between setting goals high and setting expectations high. Give yourself a little buffer zone. Be a little easier on yourself. People sell TRT as like this magic bullet that's a fix-all. You got to understand, testosterone does absolutely nothing for you. What it does is it works with you. It allows you to go out and do everything for yourself, but it won't do it for you. It is not an autopilot. Okay? It's just the fuel for you to get out there and actually take control. So if you're not going to focus on improving your life in every way possible, testosterone in and of itself is going to leave you disappointed.
And now click on this video to learn more about TRT and hormone optimization.